Today we have an amazing patient. We're going to be performing a temple brow lift, upper blepharoplasty, and a lower blepharoplasty. Here we have all the markings performed that I used as a guidance before the surgery. I'm going to be performing a temple brow lift. So I marked the temple fossa here. The incision is behind the hairline. I like to see the most lateral aspect of the hooding, and I make a little dot there so that I can extend my incision as far as needed. This lateral brow lift is just going to stabilize the brow there and help with some of the hooding. We're going to be removing some of the excess skin here. I'm going to be lifting a little bit of this eyelid, and we're going to be removing some of the lower lid bags along with the excess skin. We're about to start our procedure. We're going to start with the lower blepharoplasty. The most important steps are, number one, the incisions, which I'm going to perform it through a subciliary incision, an external incision just underneath the lashes. Then I'm going to remove the excess lower lid bags. Then I'm going to remove a very small amount of excess skin, and finally the closure. So one of the common concerns patients have is about anesthesia. So in all of the facial surgery cases that I perform, I aim to use MAC or IV sedation or deep sedation without having to intubate the patients. I feel it's much better for their recovery, but I'm going to have our amazing board-certified anesthesiologist, Dr. Munnings, get into more of the details of the type of anesthesia we use.
I'm Dr. Corrine Munnings. I'm the anesthesiologist that typically works with Dr. Rodriguez. I would say for 95% of the cases that we do MAC, which is an abbreviation which means monitored anesthesia care. Most patients refer to it as sedation. A lot of patients will remember it from what they've had for a colonoscopy or an endoscopy. It's a type of anesthesia that we use to make you super sedated, very calm, but you're breathing on your own. It's different from general anesthesia in that it's a lighter plane of anesthesia. It also avoids having to place the breathing tube. It also involves less medications. The great thing about doing MAC for our patients is that their recovery is a lot faster. They wake up feeling less groggy, less likely to have nausea. Typically, patients are walking out of the recovery room within an hour. So for those reasons, we try to offer monitored anesthesia care to the majority of our patients. Obviously, everything depends on your medical history and your previous history with anesthesia. Most of our patients are very satisfied and have a wonderful experience with sedation being the option for their anesthesia.
We're all done with our surgery. I'm all excited how she came out. Very happy with the results. Nothing really that I encounter in surgery out of the norm. She's going to be very, very happy, and I hope you guys enjoy this video and you learn some stuff about the quad bleph, which involves an upper and lower blepharoplasty.